When people hear, for example, stage 4 cancer, their hearts drop. But what do these stages mean? Stage 1, 2, 3, 4. What do they actually mean? Today, I would like to break it down in plain language. No medical jargon here today. I'm just going to describe it the way I understand it based on my knowledge and research. Just the truth about how doctors stage cancer, why it matters, and what those numbers really tell us and don't tell us, because they can tell us things, they may not tell us things. Because understanding the stage means understanding hope. The first one is the basics, what stage means. Cancer staging is basically the way doctors describe how far the cancer has spread inside the body. Think of it as a map. Stage 1 is a small local problem. Stage 4 means it has traveled further away. Just think of it like that way. The goal of staging is to guide treatment and predict outcomes because not all cancers behave the same way. Okay? Segment number 2, the TNM system explained. What does TNM mean? Most cancers are staged using something called the TNM system. T stands for tumor, how big it is, and whether it's grown into nearby tissues. N stands for nodes, whether cancer has reached the lymph nodes, those little filters in your body that help fight infection. M stands for metastasis, meaning has it spread to other organs like the liver, bones, or lungs. Each letter gets a number. Bigger number means more advanced stage. Combine them and then doctors can classify the cancer stage from 0 to 4. So, TNM, tumor size, node involvement, and metastasis. So always bear that in mind. T, N, and M. Now I'm breaking down the stages. Stage 0 is the earliest form. That means that cancer cells are just one layer, not invading deeper tissues, often called carcinoma in situ. Stage 1, the cancer is small, hasn't spread, usually very treatable, and surgery or localized therapy is carried out. That's why it's always important to seek investigation early. Number 2, stage 2, the tumor is larger or may have reached nearby lymph nodes, still usually confined to one region. Stage 3, more lymph nodes are now involved, or the tumor is deeper and more complex and may require a combination of treatments. Stage 4, the cancer has spread to distant parts of the body, called metastatic cancer. Treatment focuses on control and quality of life, but many people still live long and well with it. I know somebody that was diagnosed with stage 4 breast cancer. I've brought her to my channel before, and she was given just few months or even weeks, but she is still with us today, over 5 years ago. So taking action, whether stage 1, 2, 3, 4, what you do after diagnosis, how you react to it also helps. And what you now start eating, how you change your lifestyle makes a lot of difference, because cancer cells love sugary things and bad things. So really, if you take the bull by the horn, even at any stage, with your positive mindset as well, you are likely to have a better result. The next one is knowing the stages. It helps you a lot. Knowing the stages helps to know what to do next. So, doctors choose the right treatment, surgery or radiation, chemotherapy, immunotherapy, targeted therapy. It also helps patients to understand what to expect and connect with the right support groups or clinical trials. Staging isn't about fear, it's about strategy. Very, very important. Don't say, "Oh, it's now stage 4, or I've been given how many weeks or months to live." Yes, sometimes that might be the case, but sometimes as well, it's not the case. So everybody should treat their diagnosis differently, but not taking any action is not an option. So when you're given such diagnosis and the stage of the cancer, remember it is not the final. It does not mean that, oh, I've been told, because some people do that. They've been told, oh, they've only got a few weeks or months or whatever to live, and they start revolving their lives around those number of weeks or months. That is not good. Remember, speak to people. Do not bottle up. Do not keep things to yourself. I've said it before. Do not, because you don't know, the person you speak to might have an idea, might have advice for you, might have some recommendations for you. There's nothing to be ashamed of, because everybody, as I said before, has, we all have cancer cells in our bodies. It just depends on how what happens with your own. It can develop to cancer. So it's not something to be afraid of. Okay. I want to conclude this video by saying cancer staging is not a sentence, it is a starting point. Behind every stage number is a human story, one filled with science, courage, and hope. So, if you or someone you love is facing cancer, remember the stage doesn't define you. Your strength does. You didn't hear this. The stage doesn't define you. Your strength does. So, stay informed, stay hopeful, and never stop fighting for your tomorrow. Very, very important. Thank you for listening as we keep bringing more insights into this cancer series. Goodbye.